Welcome everybody, and welcome to the second in a series of webinars presented by Bold Climate Action in partnership with Irish Doctors for the Environment under the umbrella title of Healthy Aging, Healthy Planet. My name is Crichton and I'm from Bold, and as is Christine McGee, who will be facilitating your questions and comments later. And we'll be joined soon by Orlagh Gaynor, who is a chartered physiotherapist and is the chair of Irish Doctors for the Environment. She will be presenting this webinar, which is entitled Connect with Nature, Care for Yourself. First, I'd just like to give a flavour of what Bold is about for those who don't know us. We're a group for the older citizen who is concerned about the climate crisis and climate injustice. Although elders are often well represented in many climate groups, there may be a perception that climate action is driven by the concerns of the young. And this is often the case, and rightly so, for the young will hope to do more than merely survive in the world we are making with our current actions and inaction. But we also believe that the perspective of the older person could bring much to these issues. Many don't realise that older people can disproportionately suffer the effects of climate and environmental breakdown. We in Bold want to reach out to elders and those who work with or for elders to help make the connections as to how their lives or roles are impacted and influenced by climate issues. This is why Bold are so glad to be partnered by Irish Doctors for the Environment in presenting this series on health. We want to look at the health issues commonly affecting older people in the context of environmental sources and solutions. We hope that with these webinars to help in squaring the circle of understanding that our health exists within the context of the planet and that the health of the planet is mirrored within us. Now, a practical point is that we have been having a few technical issues, particularly with the sound. So if anyone is a bit mutton Jeff like me or corned beef, like they say in Glasgow, I might suggest you put on your closed captions because that will probably be mostly accurate, apart from the times when they are hilariously not. But it'll be the best way to cope, I think, if you're having any issues. So I'd just like to pass over now to Orlagh. It's my pleasure to do so and for her to present this webinar, Connect with Nature, Care for Yourself. Thank you, Orlagh.
Folks, it is an absolute pleasure to be here today. My name is Orlagh Gaynor. I'm the Operations Officer with Irish Doctors for the Environment, and it is an absolute pleasure to be able to partner with Bold and Friends of the Earth to be able to deliver this webinar series across on the themes of different environment and health topics that affect us as we get older as well. So it's really lovely to kind of connect those dots, and that's what we'll be doing in today's session. So without further ado, I'm going to jump into my slides, if that's okay. I'm going to share my screen and we'll get into proper introductions there. Nope. Share that one. And then, excellent. Yes, we can see this now. Okay. Can we all see a big green slide? Fantastic. Excellent. So thank you so much to Rod and Emma Jane and Christine as well, just for this opportunity. It's really fantastic to be able to get this going. So the title of today's session is Connect with Nature, Care for Yourself. And really we'll be exploring the kind of the nature health pathways and the benefit that or kind of the two-way partnership that caring for nature has on us, and also how we can care for nature and the physiotherapy perspective behind that. So I'll run into some introductions now. So this is myself. Purposely chose this photo because it was taken in the physiotherapy clinic where I work. We have a lovely garden out the back, and I like climbing trees, and I went up to pick some pears back in September. But I'm a physiotherapist in private practice. I did used to work in Beaumont and the Lourdes the first 2 years of my career. But right now, I mainly specialize in various injuries, rehabilitation, anything to do with bones, joints. But I also do pelvic health, pregnancy, and I've just started doing a little bit of vertigo and dizziness as well. I'm a senior physiotherapist, so I get to see the head scratcher cases, and I've a bit of a reputation as being somewhat unconventional sometimes. So the patients who don't respond to traditional physiotherapy, I bring in this extra lens to it of of what we'll explore on the theme of social prescribing, and we'll get into that later. Kind of a very holistic type um, of lifestyle prescription. I'm also studying a master's as well in planetary health, which is the link between the environment and our health, with an online Catalan university. And when I'm not doing all that stuff, I'm the operations officer with Irish Doctors for the Environment. I'm a big nerd, and sometimes my mouth goes a little bit faster than my brain, or the other way around. They're not always in sync. So if I pause, I do apologize. So, who are Irish Doctors for the Environment? We are a voluntary NGO and we're a registered charity. We've embraced the misnomer because we're no longer all doctors. We are now like healthcare professionals, and we aim to create awareness, interest, and we implement action surrounding environment, health, and the impact it has for our patients, who are the general public. And we work alongside other NGOs such as Friends of the Earth, environmentalist scientists, to educate and promote healthcare as a key issue. And that's a picture of ourselves at our retreat back in October. So, the first thing, before we jump into all this and kind of nature health connection, I'd like to check in with ourselves, just to take a few moments to pause and reflect on our own relationship with nature. So I'm going to invite you now just to close your eyes and take a breath in through the nose and out through the mouth. And I'm just inviting you to turn the volume down on all your busy thoughts and worries for a moment. And I'd like you to think of a place that feels welcoming and safe to you in nature. Perhaps it's a certain beach or a green area like a forest or a field or in the mountains. But I just want you to bring yourselves back mentally to that area, wherever that may be, and just connect and tune in to the breeze on your skin. What do you notice about the place? What can you see? What can you describe? Is it a place with water where you can see the light glinting on the surface? Do you notice the light coming through the trees? Do you notice the different shades of colour? What does the ground feel beneath your feet? Is it soft? Is it sandy? Is it moist? What do you notice that is moving in your surroundings? And what do you notice that is still? And just taking a moment just to label what you see in your mind's eye, in your safe place. What do you hear? Is it a rush of leaves? Is it the wind? Do you hear water trickling? What can you taste and what can you smell? Is it cool and fresh and earthy? Or is it salty? Just take a moment to be present in that safe space. And now, how do you feel in that safe space? Do you feel calm or at peace? Just take a moment to label the feelings that arise in you when you are in that safe space in nature. And let that feeling, if it's a good feeling, let it fill every corner of your being. And we're going to take that feeling with us today and just carry it with us like a talisman just glowing in our chest. And we'll just say a short goodbye for now, but we'll be back soon to connect with nature. We'll just take a breath in through the nose. And if you want to squeeze the muscles in the hands and take a deep, deep breath in. And then exhale, completely release. You can open the eyes, come back to the room. And that was just a little bit of a mindfulness meditation exercise to connect ourselves with nature again, and just to really remind ourselves, why are we here? And for that feeling and connection to ground us in that connection. But I hope you can take that feeling with you today. But so going forward, we felt I hope that a lot of positive feelings came up when you felt connected in that safe space. And so what we'd like to chat about now is, how does nature really benefit our health? So we felt those that really positive feeling arise in us, that peace, that calm. That's why we get drawn to water, to those green spaces. But there is actually some science behind it. And this little infographic. It just details all the pathways that nature, in how nature benefits our health. And this is taken from a scientific paper, and it was on biodiversity and health pathways. It's a 2021 paper. I've just made it a little bit more simple. So there's just took out the jargon. But when we have biodiversity, and biodiversity meaning a plethora and variety of native plants and animal species, and when we have contact with that, whether we know it or not, so there's a slight difference recognized in the research between whether we're just exposed to it, or whether we actively engage with it. And that when we engage with it, we amplify those benefits even more, but we still have benefits from it, even when we're not, even if there's a field somewhere that I'm not aware of, but we still get these other benefits of it when we're unbeknownst to us. So we get exposed to natural microbes in the air when we are walking through parks, or any kind of natural space. So trees and plants and fungi all give off really tiny, like, microorganisms and microbes, and that is good for us. We need that exposure for our immune system to be regulated, and so we're not super hypersensitive, uh, and it just regulates us in that sense. But we've also just had a little taste of the restorative benefits, like how the psychological benefit of being in nature as well. The like why we flock to green spaces, why we go to the water, that peace we get in pleasant surroundings, looking at like a glassy blue lake, or the light through the trees, and just being in those surroundings, or looking at the colors of flowers. It also it has a social benefit as well, because those open green spaces are really conducive to social gatherings, whether it's spontaneous, or we plan to meet people, or even hosting community events. So that sense of involvement, and that's really important for our own sense of belonging and identity. And of course, green spaces, or just being in nature as well, is offers opportunities for physical activity, such as like walking in forests, or gardening, or our last webinar was on active travel, so like cycling as well, and swimming. So there's so many ways we can engage with nature uh, that are good for our health, that offer these opportunities to be physically active as well. Um, and aside from our own engagement with it, actually just having nature and natural spaces there, it produces an environmental buffer, like a shield. So trees will help reduce air pollution through their natural filtering processes. It also helps with reducing noise pollution. It also helps, vegetation will also help with reducing flood reduction or flood risk. So there's the the strands and pathways are very many, and they all just culminate in overall health and well-being benefit, from reduced stress, disease prevention, from exercise, reducing risk of exposure to hazards, such as like the flood prevention example, and immunoregulation as well, through the microbe exposure and physical activity as well, and just and psychological well-being. So, oops, nope. There we go. So why is this important as we get older? So as we get older, there is a natural aging process of muscle and bone loss, and cell regeneration slows down. So this increases our risk of inflammation, cardiovascular illness, respiratory illness, cancer, fractures. There's so many kind of different risk factors that naturally go up. However, what we should be asking ourselves is, is there a way to modify that, or can we mitigate that risk? And usually it comes down to us ourselves slowing down. So the question here is, do we slow down, or does life slow down for us? And life tends to not present us with physically challenging opportunities as we get older. I'm the eldest of four siblings, and I always look at my youngest sisters, my youngest sister is 15 years younger than me, and kids always just love like chucking themselves out of trees, and just they just find opportunities to get up to all sorts of hijinks, and and they can be quite physically challenging. And as a physio, like, yes, we can kind of cut it down within reason, but we shouldn't have to completely wrap ourselves in bubble wrap either. And we're going to get into this a little bit more as we kind of learn how to balance, or certain physical conditions physical with physical challenging opportunities. So, but as well as that, there are many, many, many lifestyle and genetic factors involved with the aging process. So being physically active is obviously good for us, but also diet as well, sleep, stress, and exposure to stressors, as well as genetic factors. So it creates quite a rich tapestry there of what really determines our health. and it's a webinar in itself. But with my physio hat on, I'd love to get into muscle and bone health as we get older. The short answer here is use it or lose it. If you take one thing away from today, in terms of muscle and bone health, if we don't use our muscles, we lose them, and that is a natural aging process. But we can stave it off by maintaining active. So what happens is muscles exert tension on the bone, and these receptors in the bone cells, they cause more bone to be laid down. Those cells that lay them down are called osteoblasts. And if anyone here has osteoporosis, and you may be on certain medication that stops the reuptake, like ibandronic acid will stop the reuptake of bone cells. But so it is a natural kind of cycling process. But what we can do to mitigate that is keep exerting that tension against the bone. So I've included here an MRI of 3 people. We see a 40-year-old triathlete at the top. We see a 74-year-old sedentary gentleman. As you can see, the muscles are quite shrunken there, and there's a lot of adipose tissue, like fat around it. So those muscles are gone weaker. But the 70-year-old, so man of a similar age, who is a triathlete, his MRI nearly actually looks better than the 40-year-old triathlete. He's actually got less adipose tissue there, but it's on a par, and it's it really just shows that we can stave it off in a lot of in most cases. So that natural kind of muscle loss process we can mitigate against by keeping active within our capabilities, and that's where physiotherapists come in. But we need to be not afraid of lifting heavy. When I say heavy, I've put a little asterisk there. It needs to be challenging, but not extraneously so. It's not a case of I will suddenly lift that insanely heavy flower pot. It's lift heavy, lift challenging, like regularly, and then when you do have to go and lift a heavy flower pot, it's much less it's much less challenging. But if it's a sudden increase, obviously everyone does their own safety risk. If it's a sudden increase of load, that's where the injury risk comes in, and we don't, it's better to ask somebody for help with that. But I'm really happy to answer. I know this can open up a lot of questions and stuff, so do please pop them in the chat, because there'll be time for questions at the end as well. But stay challenged is the message here. So impact and tension on bone from muscles, that cause new bone to be laid down. But there's obviously a big factor with diet, as well, calcium and protein. But what we mean by impact through the bone is actually by little bits of shock and impact, like any kind of stamping or stamping activities will kind of bring that shock through the bone. There's in Spain they do a few studies on flamenco dancing for osteoporosis, because it's a lot of stamping. And I've often wondered, like, well, why not do set dancing? Why not do a study in like Irish set dancing? I think it's a wonderful community activity. And I used to always see, when I lived in Spain, like older women, in particular, like just dancing flamenco in the street. There was a parish priest actually who loved it as well, when I was in Benalmádena. But I've just included there, it's an archaeological study of, you can see these little like bony deposits being laid down, and that allows archaeologists to actually identify, when they know the anatomy, what the activities of an excavated person were like back in ancient times. You can tell who was an archer, who was a metal worker, just from the muscles that they likely were using based on the bony deposits. And that's how that works. It's more tension, more impact through the bone, and that that lays down more bone. Sorry, I could nerd out on this for quite a long time, so I'm going to try and keep it fairly concise. So something I see a lot in clinic are people asking about certain scary words or having kind of certain preconceptions or things that were conveyed to them by other health professionals about their conditions, such as osteoarthritis, rheumatoid arthritis, osteoporosis as well, and slip discs also come up as well. Now, discs don't actually slip, but they prolapse. But what I really want to say here is it does not automatically mean we should stop activity. It's really about keeping it loaded within our capabilities. Exercise is medicine, and the dosage is key. There is a way to get it right when you speak to the right healthcare professional. That's what we're here for as physiotherapists, and I would strongly encourage you to that if you have any doubts and if you'd like to increase your physical activity, to chat to a physiotherapist about what you can do and maybe exploring the limits as well. But everybody is so different, and we're going to explore that in the next slide. So I have two x-rays here. So these top two is one person. So person A, I've got just a view of their knee. I've got person B. And I want to get you to pop into the chat. Have a look at their x-ray. Which one, person A or person B, is likely to have more pain in their knee? Or which person do you think has less pain, has more pain and less function in their knee? Pop it into the chat there. I want to see the result, what people think. Okay. We all reckon B has more pain. Okay. So yeah, because you can see that the joint space is much narrower. Yeah, so I'm gonna surprise you all and tell you A actually has more pain. So this is a comparison between two people. This was measured with the Oxford Knee Score, which is like a survey on various pain and function. So the Oxford Knee Score, the OKS, is a maximum score of 48. So if you have like perfect knees, you'll score 48. Person A scored 15 out of 48, and person B scored 36. So there you go. Your x-ray is not the person. And I'll never forget one of my lecturers in college saying how he worked in Birmingham and there was a very high Muslim population, and so a lot of Muslims, if they are very observant, they will pray 5 times a day, and it involves various squatting and kneeling positions. And he just found that they had, like, if he was to grossly compare with the non-Muslim population, he found that his elderly Muslim patients had, equally terrible x-rays, like just looking at the x-rays, but really good function and yeah, a few twinges and a bit of pain, but really good movement and really good strength because they were engaging with that type of exercise, even like built into the prayer. So if your doctor says yes, it's bone on bone, it's like, okay, cool, but there are ways around it, is what I would say, and this is what we do as physios. Just yeah, and osteoporosis as well. Doesn't mean that you shouldn't do certain things, but the bending and like curling of the spine is just there's a few precautions around that, but other than that, it's about preventing falls and preventing the risk of fracture. So working on our balance is really important here. But for these conditions, there are multiple systemic factors involved, like our diet, like our our physical activity, our stress, our sleep as well. But ultimately, yeah, bones and joints just need a bit of mild impact and to be loaded to maintain and build resilience. Oops. The same for heart and lung health. So we see these same factors coming up again. So cardiovascular disease is the leading cause of death in Ireland. It's responsible for 1 in 3 deaths. And for respiratory disease, it's 1 in 5 deaths and affects 380,000 people in Ireland. So we saw how muscle cells don't regenerate as well as we get older. So the heart muscle stiffens and you get that reduced efficiency. Blood vessels reduce elasticity, and our lung capacity just gradually declines. So there is a natural aging process to it, but physical activity, as well as the other systemic factors that we've mentioned before, play such a huge role in determining the outcome of that. So for brain health as well, so to maintain our mental well-being and our mental health and to prevent cognitive decline as well, we absolutely need social interaction as well. So 20% of Irish people reported that they felt lonely most or all of the time, compared to 13% of all Europeans. This was a huge EU Commission study. So we're quite a lonely nation, and as our older population gets bigger, we definitely need to do something about that. So like loneliness is linked with dementia, as well as cardiovascular disease and other mental illness like depression and anxiety. Our physical activity plays a huge role here. The bottom line is if you keep the heart pumping, it keeps the brain fed. But also chat with people and we stay connected. So we're going to explore a little bit on green health and what we mean by it. Time spent in is basically time spent in green spaces. You might hear something called third spaces or third places being used as a term. Basically, what's meant by that is your first place is home, the second place is often considered work, and the third place are free leisure spaces to access for the public. So these are public parks, forests, community gardens for fruit and vegetables. So it really involves this connection with the land and our plant species. It can be gardening, could be conservation work, but access to green space is associated with great privilege. We very often either need a back garden or a park, and if we don't have those, you're reliant on a car to get out to like mountains and kind of walkways. So it's just important to bear that in mind in terms of for advocacy as well. But everything is exercise. Having time in nature gives us so many opportunities for physical activity and exercise as well. Like we have when you're gardening, like bending is a deadlift. It's really good for our back and our hips. Coming down onto our hunkers, you're squatting, you're strengthening your hip muscles and your leg muscles. When we reach, it's really good for balance as well as our back and our arm strength. But as well as that, opportunities for active travel. So using our greenways, or when the active travel infrastructure is implemented in cities and towns, then that means we can get out on the bikes on certain or on types of wheels if it's not a two-wheel bike. So that's what those opportunities offer us. Blue health refers to our blue spaces or our waterways. And connection with water. So there is like a documented psychological benefit of being in view of water. And swimming in our natural spaces. Swimming is a fantastic low impact cardiovascular exercise. It's if you're a keen swimmer, as you can see from the picture, I love paddleboarding and I love swimming. I encourage it to everybody and usually yak on about it to my patients. But people with reduced mobility may need a handrail and steps. And that's where we need kind of investment in dedicated swim spots. Um, so and clean water as well. So I've just kind of included an example here. I visited this place. It's in Crosshaven in Cork, and I snapped a terrible picture of the notice board, so I'm going to read it out to you. But this place is called Grabble Bay, and it was a dedicated swim zone, a natural kind of bathing area. Um, just the notice board here says galas took place in Grapple Bay from 1939 to 1950 by Sundays Well and Dolphin Swim Clubs. People from the area and who holidayed there took part. The swims were 25 yards long. Some rocks were cemented to create stops, plus a diving board was also put in place for competitions enjoyed by hundreds. And like, we don't really have these spaces anymore, like, or they're very few and far between to organize outdoor swimming events. And I wonder, was it like emigration in the early to mid um, 20th century that kind of declined the population of Crosshaven, that led the place falling into decline? I don't know, but it would be wonderful if we did have these spaces and they were accessible as well, you know. But I would love to see more investment in our more swimming and more opportunities for swimming. So, just to kind of tie everything together, what we've seen. So we've seen that nature offers us so many opportunities for physical activity, social connection, and that it's psychologically restorative. It's good for the immune system. But there's also this wider connection with our heritage and culture and our identity and our language. And that's something I've been exploring. I moved back from Spain in the middle of the summer, and I've uh, I emailed Rod a selection of resources there, and I can't pop them in the chat right now, but I will in a sec. But I would that connection with learning our native species and like the Irish words for them, and I really wanted to include here a little animation that I saw of there was actually a video of Spanish people dancing like flamenco in like a field, and we don't get those opportunities anymore. And it was a thing that we would have ceilidhs out in the crossroads, and it's something that we've lost as part of our heritage. Um, but like everything is so connected, and it opens up that opportunity to explore our heritage a bit more. And I'd definitely encourage you reading Moncton Magan's books. And I discovered these apps the other day about like identifying native bird species, the eBird app and the Merlin Bird ID. You can like record their calls and it will identify them for you. And you can submit them as well to Biodiversity Ireland. They have different campaigns. So there's so many ways to get involved. I've mentioned them a bit later as well. Sorry, I'm going off on a slight tangent. So, given all those opportunities that we have, and the overall well benefits to our well-being that connection with nature has, um, I'd like to talk a bit about something called social prescribing. Now, it can exist under different names, but this is a new term that is used in the literature a lot. Somebody presented on it at a HSE Environment and Health conference back in September. And I was like, hold on, physios have been doing this for ages. Why is a doctor presenting this like it's a new thing? So I've been kind of telling physios to get on this now. But it is basically an overall well-being prescription. It's prescription for connecting the patient with non-medical activities in their community, either instead of or alongside traditional medication. So your first points of care would be your GP, your nurse, or your physio. They may prescribe like exercise groups or community classes, support groups, or arts. And the aim is just to support the whole person and their identity. So um I'm going to talk about the HSE social prescribing framework here, but one of the and I'll send a link to it as well to this document. But one of the case studies that they mention in it is it's not just for the older population; it's for everybody. But a 21-year-old gentleman with spina bifida was in hospital and was talking with some of the healthcare workers and generally reported this sense of like social isolation. And so they put him in touch with the social prescribing team in his local primary care center, and she just the link worker happened to know of um a greyhound trainer, and like upon talking to him, like just got to know him better and knew he had a great interest in greyhounds. And so she just like rang up this greyhound trainer and was like, listen, I have a gentleman here, he's one of my patients, but would you take him on for like learning how to train greyhounds? And he did. He took it on, and um and it just helps with that sense of purpose and belonging and identity. So your social prescribing, like a lot of primary care centers have a social prescriber. I would really encourage you to link in with them, either if you feel like you could benefit from the service yourself, because people can self-refer, or if you have a community like initiative or a project, or if you're part of a group that you could say, hey, we're here if you want to direct interested people to us. In IDE, we have just gotten funding to write up a HSE toolkit, to incorporate nature into social prescribing. That's not just for the HSE social prescribers, but also for like GPs and nurses and physios. So this is a training document for HSE staff that we're doing, and we'll get started on that very soon. But one example here is this is the Kiri Farm mental health facility in Clare, or in Clare, what I say? It's near Clane. That's where I get mixed up. It's in Kildare. It is a mental health facility, but it is also an organic farm, and it's run by psychiatrists and psychologists. One of our own clinical psychologists in IDE is the director here. So it is there's medical psychiatric support, but also the therapeutic effect of being in nature and connecting with the land. So the framework here, or just some of the benefits for the older population, include like delaying and preventing admission to hospital or nursing home, kind of uh, improving systems around the older person, um, improving resilience, reduce social isolation, and just increase well-being. And in that sense, it should reduce the need for prescriptive medication as well. Um, so we see this kind of, we should also kind of ask ourselves, like, we can, like, when we connect with nature, it benefits us, but also how does connecting with nature benefit the planet as well? What does it matter? And it really is like a two-way connection. Because when we look after nature, nature looks after us. And it creates this, when we engage with nature, we foster this stewardship and sense of responsibility, this pride of place. And that creates like a positive feedback loop that does go upstream. But those like there's a lot of natural solutions to certain problems that we have. Like we mentioned, how green areas reduce air and noise pollution. We need clean water for not just swimming, but also drinking water as well. If our water gets too polluted, our water treatment systems won't be able to handle it. Um, and a we can, that river and mountain vegetation, like if we want to reduce flood risk, uh, we can help biodiversity as well. Like, so it is two-way. We can improve biodiversity, and that has the added effect of helping our food networks and healthy animal and plant life. Um, so so like the more engagement we have with nature, the more people we have invested in it. And I think I love the bold ethos of, or like that narrative changing of climate change isn't a young person's problem. It is absolutely a problem that everybody should be concerned with, regardless of age. And we need as many advocates for that as possible. Um, like and that's really what that engagement with nature does. If we have a community bought into nature preservation and conservation, then that feeds upstream into policy as well. It creates demand for those protective green policies. Chat to your local council and voice your support for green initiatives, or and give feedback where if the designs are not like are good but not great, do you know, and just creating that voice and joining your voice to the chorus for environmental support. But also social prescribing as well for yourself or for others. It's an alternative, like we said, it's an alternative or adjunct to traditional medication-based treatment, but medication production is really carbon intensive. If we take inhalers, for example, like some of our common inhalers release the equivalent emissions to as like driving a car from Dublin to Tralee. The chemical waste ends up in landfills, incinerators, and waterways, and engaging with the social prescribing principles, it prevents hospital admissions as well. And healthcare is really carbon or emission intensive. Healthcare, if healthcare were a country, we'd be we'd be the fifth largest emitter behind like Russia and China, and in India. It's, you know, the environmental cost of a hospital stay is huge as well, and it's something that we're trying in IDE as well to bring attention to. So, what can you do? The first thing I would say is just become aware of how much time do you spend in nature. Just kind of reflect on that. Is it possible to increase that time? Can you engage more with nature? Are there conservation opportunities? Nature-centered meditation. I have a link to that as well, and we'll pop it into the chat. Learning more about native species. I'd really encourage everybody to do so if they can, and I'll pop as many resources as I can find. Contact your local primary care centre if you feel like you would benefit from linking in with a social prescriber. Your local primary care centre should either have one, or they'll be able to direct you to the nearest one that does have one. And let your social prescriber know about your community as well, about Bold, about if there's people in your local area who are involved with Bold or Tidy Towns or anything. Let them know, say, we're here, send your people to us. We chatted about increasing physical activity despite, even in spite of certain conditions that can be limiting. Chat with a physiotherapist just about that. I'm seeing so many increased consultations for people who have nothing acutely wrong, but they're just like, I just want to get more active. And how can I do that? Because I have arthritis or osteoporosis. People want to know what's safe and maybe where they should draw the line. And that's what we're here for. And as well as that, just advocating for any green infrastructure, any initiatives that promote biodiversity, and active travel planning as well. Because councils get a lot of people voicing negative opinions, which obviously needs to happen, but knowing where they're going right as well is also really, really useful, and every voice is valuable in that. But before we go on to the next stage, I'd like to read a wee poem by Wendell Berry, just to kind of round things off, called The Peace of Wild Things. And I think it really ties in the nature health connection really well. And it goes, when despair for the world grows in me, and I wake in the night at the least sound, in fear of my life and my children's lives may be, I go and lie down where the wood drake rests his beauty on the water, and the great heron feeds. I come into the peace of wild things who do not tax their lives with forethought of grief. I come into the presence of still water, and I feel above me the day-blind stars waiting with their light. For a time I rest in the grace of the world and am free. And guys, that is me effectively stopping talking before I move on to the next stage. Thank you so much for listening. I hope I I didn't have my timekeeper with me because I changed rooms. So I hope I was okay.
Thank you. Thank you very much, Orla. That was really lovely. It doesn't matter how long it was, but it was just that lovely sense of joy and possible connection, possible solutions, connections, and the myriad of connections between our health and our nature. So thank you very much. And we're going to move on now to suggest people go into small breakout rooms, which Emma Jane was going to set up for us. And we're hoping maybe to get the chance to, I suppose, to continue in the whole solution space of talking about, and we have I think we're going to just put it up here on the screen now, to talk about or brainstorm ideas for activities or initiatives which would build social connections between people and build nature connections and help us to keep stronger as we age. Thank you, Jane. These can range from the smallest personal actions to community initiatives to national activities. So it's the thing about just taking all the lovely information, ideas, possibilities, and having a chance to chat to each other about ideas for how we might build that into our lives or our community's lives. So we're Emma Jane's going to invite you to join a small group, and then we have about 15 minutes at most, I would say, in that group. And hope to come back to this bigger group. We'll do a quick go around to collect the ideas and on a whiteboard, which we'll then try and compile so we can send that out to people. We may be able to hopefully enact or make something happen with some of those ideas, and we'll see how we go with that one. And then there will be time for questions. So is that okay, Orla and Emma Jane, or?
Yeah, I can open the breakout rooms now. If there's no questions or issues, you should see a little blue invitation, like a pop-up button pop up to join the meeting room. So you just press join, and in you'll go. I'll pop around and see each group in case anyone's having any trouble. Okay, I'm going to open them now.
Thank you very much for taking part in the breakout rooms. We had certainly a lovely conversation in our group, and very much inspired by Orla's sort of positivity, and the sort of sense of how the research helps to support the important actions we need to take to connect with nature, and how much that's needed to allow us to give that time to it. But if we were just to take some quick feedback from each group, just about some of the ideas, so people can hear those ideas. If you've more you want to tell us, you could always put it in the chat box, but we'll try and do it sort of quickly so that we can actually have time for questions with Orla before we finish up, if that's okay. Actually, I'll also encourage you to stick your questions in the chat box so we can be just getting them collated if they're there. So would anybody from group 5, if you knew what group you are, oh great, like to say to us some of the ideas they came up with in terms of activities or initiatives.
I can, if you...
Great.
Yeah. So, yeah, I suppose we talked initially, about the reality of being older people and wanting to have physical activity, but realizing that everybody has physical issues, often have physical issues which limit how much they can or have been able to do thus far. So we wanted to acknowledge that, really. And there's a number of us who are involved in exercise classes at the moment, and whether some of those aspects could be taken outdoors now that the weather's improving. That was a thought. As far as socializing in nature was concerned, I think the sort of the benefits of the pandemic almost were mentioned. That it forced a break of habits. People were able to think of things differently, and they needed to get outside to meet people because there was no alternative. But that maybe has sort of slipped back because we're getting back into older habits. And then there was a thought of, not that we had any particular plans, but we suggested we could be meeting in nature to try singing, to try just to be creative in nature. I almost thought it might be possible to meet in a forest and to pretend that somehow we were embodying the spirit of the forest, that we were kind of wood creatures or something. We could be popping out from behind trees. You know, in a way, it's to try and square a circle of being in nature, but also thinking of yourself in a creative way within nature that would lift, hopefully, your spirits and also give you physical exercise. So that's just kind of rough thoughts. And also for valuing being, most of us being in Dublin and access to some really good parks and so on.
Thanks, Rod. And it's nice, actually, what you're saying there, that link between the singing in nature and Orlagh's ending with the poem. And I think that thing of art and nature, and often they can sort of enhance each other, which is a nice theme for us to take forward. Number 4, I'm moving along swiftly because I don't want to miss the time to chat to Orlagh at the end. Are there be any ideas that Group 4 would like to share with us?
I was in Group 4 and I'm with Liz Kelly, and she's South Dublin Council, and Mary Healy and Sheila Cullen. So I explained about cycling without age, and they weren't all that familiar with it. So I explained how the whole thing works, and it's all voluntary, including me. And it's so perfect for social prescribing. Yeah. And it ticks all the Orlagh boxes in terms of out in nature, you're connecting, the loneliness issue is taken care of. Because there's 2 people sitting side by side and the pilot's right behind you, and so there's this constant opportunity to meet and chat. It's great for the volunteers, for the pilots as well as for the passengers, and it's free. And we want everybody to use it, and I'm constantly plugging it because I'm a volunteer, but the whole point is just to get out there and find out where your local trishaw is. And I want all the social prescribing people to really take note of this. And it's not just for old people, it's for the biggest users, particularly say in the bike hub in Dunleary, where they've 2 trashes, is St. John of God's youngsters and they're all, intellectually challenged, but they go every week. And actually next week they've asked me to come out and train more of their staff.
Right.
So their staff can take their own people out, which frees up my volunteers, but it also means that the carers know their people closer than our pilots will.
And Clara, I see that you put in a link earlier in the chat box, but maybe you just pop it in again, will you, so people can do that. I mean, absolutely. I meant to mention, recognize the link that you put in. Was there? Sorry, now I agree. The cycling without age is a perfect response. Is there any other ideas from your group that we should note down, or obviously that's good enough to have just talked about that in your group?
The importance of volunteering.
Yeah. Okay. Great. Thank you. For everybody, the volunteers.
Both sides. Absolutely. From the health benefits, the self-care benefits, but also for the other people as well. Yeah.
Yes, thank you. And there's so much volunteering going on in tidy towns and planting up and all the rest of it that actually it really fits in. Thank you, Clara. I'm wondering, could I go on to Group 3? If there'd be anybody who'd be happy to give a little feedback of ideas from that. Or while we're thinking about it, is anybody in Group 2 happy to talk?
Yes, I could just mention something and introduce someone else to talk about Group 2. We had a great discussion about coastal walks and bowls, indoors and outdoor bowls. And we were talking about generally about the benefits of walking. And Dick Wellwood, who was in our group, mentioned that he had starting 20 years ago, he created a forest beside Abbeyleix Bog, and which now gets a lot of visitors. And Dick was saying that if a group of us ever wanted to go out to Abbeyleix Bog, he would rendezvous with us there. and show us around. And apparently there's a bus that goes right outside, because it's actually on a main road. So that was a fantastic offer from Dick. Dick, do you want to say a word or two?
You might be muted.
Now, Caroline, oh yes.
Yeah.
If Dick isn't available now, maybe Dick, I think that sounds a really exciting possibility. We could possibly follow it up after this, and because I'm aware that there's two more groups who might want feedback, and we'd like to get to Orlagh.
Go for it, yeah.
It's really exciting and lovely option, if that's okay. Okay, does anybody in group 3 want to feedback, or should we just go to group 1?
Well, I was in group 3. Hi, my name is Mary. And there was only 3 of us in discussion, even though you said there was 5 names, so the other people mustn't have connected. But we really mainly spoke about things that are already sort of in place, and things like getting people leading walking groups out in nature, more allotments, because there's always waiting lists for those. But we also did acknowledge that as people get older, they can't always physically work on an allotment. We were also saying if people could get schools interested in having a biodiversity, flower bed, or something about growing seeds, or maybe planting bulbs in the autumn, and then the kids see them growing in the spring, trying to get them involved from a younger age as well. Maybe we went off topic a bit there. I don't know. We're supposed to be talking about elderly people or not. I don't know. I missed all of the discussion previously. I only got in time. I forgot about it. But anyway, and that's all I can remember now, unless anybody else wants to add anything.
That's great, Mary. Thank you. And I think that actually that whole thing of working with schools is that thing of volunteering as well. It's that thing of you can mix age and youth, and there are lovely opportunities in that too. And then group 1, I was in group 1. I don't know whether anybody else would like to say anything, or will I just give a quick go for it? I'll just do it quickly because I know we're running out of time. There was a lovely idea about, I don't know whether people have heard of pocket forests. So that idea maybe of a group in your local area getting together to develop pocket forest, which is a very tightly knit. We can put the link into the group chat. But it's just that thing of doing something that's positive for nature with the local group. And tending to it. And the other was the notion about that there is a lot of stuff going on that you can find out through local authorities, which it would be good to link in with. And there is also the spreading the word about social prescribing was another thing we thought was very important to do. And finally, in some of the areas where we're living, there are really lovely walks, but perhaps as a way of encouraging people to know that the value to their health of doing some of those walks. So those, is that good enough from Maureen and Barry? Or
yes, thanks.
Okay, great. Thank you. Thank you for the lovely conversation. Okay, I know Emma Jane's been capturing all that on a whiteboard, and we'll hopefully be able to do something with some of those lovely ideas. Especially, we've had some lovely offers as well. I'm wondering now if we might just move to a couple of questions to Orlagh. And are there been any particular ones there I've missed in the chat box? If people are still thinking about their questions, they could pop them in. I'm not sure I'm seeing any particular questions there.
I didn't see
right?
Christine, no.
Yeah, I'm just having.
Yeah.
Sorry. No, I was just having a look through. I can't see any, but I'd love to, if you do have any, do shout. Because I'd love to answer them. Especially, I know that I perhaps I came across. I don't know. I always risk being a little bit too optimistic sometimes, and people when I talk about. Oh, limitations and physical conditions. I do recognize that. Oh, Barry, sorry, Barry, I see your question here. Is it fair to tell patients to push themselves to 5 out of 10 pain only? I tend to say this. Um, I I find the numerical rating scale can be very like different for people. What I like to say is, um, I say, look, if it's a little bit of pain, but you can go through it, and it doesn't increase, keep going for a bit longer. If it starts to ramp up a little bit, um, it's your sign to stop pretty soon. But if you're starting to kind of grit your teeth and wince, you should probably stop. And it's not that you're doing harm as such, but you'll most of the time you're not doing harm as in damage and tearing structures, but you'll really irritate it, like whether it's like a knee or a shoulder. And that can be hard to settle down. So it's about changing that narrative of something being damaged beyond repair, but when something is more irritable, it's a lot more manageable, and that perception of something being manageable is really important to patients as well.
I'm aware, Liz, that lots of people were finding it valuable to know that there's a research basis to a lot of what the information you presented today. Will you be able to, you'll be able to give us some of the links to those that we can send on to people in the follow-up email? Is that right, Orlagh?
Oh, sorry. Yeah, I think so. I've put some links there, but I've sent them on to Rod there, and if anyone else has links as well. I just see another question. If no social prescriber in the local primary care centre, can you access that service in another centre? My understanding is yes. Like it because not all services are available in every primary care centre. Like a county will have different primary care centres, and so it mightn't be the one right next to you, but it might be the one in the next town. And I like the flexibility of it would lead me to say yes. But I am open to correction on a case by case basis. But I should think so. But they should be able. It's the whole role is to make sure that you are supported socially, and so they will definitely do something with for you. So do contact them.
I'm aware that actually we have run out of our official time. And is there anything there else that we should answer before we go? If not, I would hand back over to Rod to do a final thank you and finish up, if that's okay. Is that okay with you, Orlagh?
Oh, yeah. I've got some time.
Thank you very much.
Right. Am I back?
You are.
Thank you. Thank you, Orlagh. That was a really interesting, really inspiring presentation. And so much to see and learn there. Just fascinating for me, just looking at those images of the legs, of the different condition of the legs in people, of different ages and levels of fitness, and just how much is in our hands really in that regard. And also just very inspiring just to think about the possibilities. So thank you, Orlagh, and thank you indeed to everyone who participated in the group chats and gave of their thoughts and opinions. And there'll be some contact details if you want to get in touch with us about the webinar. We've recorded the webinar, and we will be contacting everyone who registered by email to give them a link, to be able to watch the recording later. We'll also be sending an evaluation form to fill in, and we'd greatly appreciate it if you could share your reflections with us as part of our learning to help us improve our work going forwards. Thank you to everyone again. As I said, this is the second in a series of webinars entitled Healthy Aging, Healthy Planet. We will have another on Wednesday, the 1st of April at 7 p.m, which is entitled Plastics, They're Everywhere. Is this a problem? Now, the webinar is on April Fool's Day, but the plastics are certainly no joke. There will be further webinars to follow, as you'll be aware from previous emails, and you'll get reminders nearer the time. Thank you again to Irish Doctors for the Environment for being so open and supportive of these webinars. Bold also partners with other age and climate organisations to campaign and educate at local and national levels. And as well as holding these webinars, we have in-person education events and workshops are involved in public actions. And we really want older people to be seen and heard on the climate crisis in the public arena. New members are very much welcome. We are supported by Friends of the Earth in the work we do. The solidarity of their ongoing support is valued greatly by us. And we want to say a big thank you to them, and especially to Emma Jane for hosting this webinar and doing all the great work that she does with us. So thank you, everyone, and I hope we'll see you again.
Thank you so much for listening and participating, everybody. And it has been my absolute pleasure to do this with you all today. We'd love to hear any further questions or comments. Rod has just shared the Irish Doctors for the Environment email as well. And we're really excited to deliver more. And thank you so much to Emma Jane and to Rod and Christine for just kind of making this happen. So thank you so much. And I hope you enjoyed today.